Hi, my name is Elizabeth Campbell. I'm a physical therapist at Limitless Physical Therapy here in Cortland, New York. I am a pelvic health physical therapist as well as an orthopedic and sports physical therapist. This presentation is a brief discussion on constipation and the role of pelvic health, specifically pelvic physical therapy, to help address symptoms of bowel dysfunction and as they relate to an individual's experience of pain and gastrointestinal health. At Limitless, we are on a mission to grow a thriving community that inspires the best possible health outcomes. And pelvic health is really a realm where we can impact so many individuals, as about 1 in 8 adults, both men and women, will experience symptoms of pelvic floor dysfunction in their lifetime. So that can be anything from bladder dysfunctions and symptoms to sexual dysfunctions to bowel function and pain. Constipation is a highly prevalent condition. Um, with about 1 in 2 and 1 in 3 adults experiencing it within their lifetime. And it is a condition that has a great impact on the pelvic floor function. And we see its role play out in developing symptoms of urinary impairment as well as sexual dysfunction. So having an impact on constipation can dramatically affect people's lives for the better. So this brief discussion is going to talk about what constipation is, the role of pelvic PT, and what pelvic PT consists of, because that's kind of a big mystery to individuals. So physiologically, when it comes to our gastrointestinal system or our GI system, what occurs is when we eat food, it is initially broken down, its initial phase within the stomach, and then it slowly moves throughout our colon, so our small colon and our large colon, until your bowel is formed within the rectum, and then you have a rectal pressure or sensory experience or an urge that's telling you need to go to the bathroom, and then you pass your bowel movement. The muscles within this system are very good at helping to move your waste throughout your GI. So you have circular muscles within the colon that are slowly propagating your waste through, and then you have specific set of muscles within your anus and your rectum that are also helping to propagate your waste through so that it can exit well into the toilet. Some of these muscles are what's called smooth muscles, and other muscles are skeletal muscles. So think skeletal muscles like the muscles on the external regions of our body. So our quadriceps, our biceps, triceps, our glutes, things like that. So some of these muscles, the skeletal muscles, we have a great impact on. And the pelvic floor muscles are skeletal muscles that we can contract and manipulate and control and train. And a lot of the times in the case of constipation, the pelvic floor muscles are playing a role and are something we need to address, whether it's making them stronger, giving them better endurance and coordination, or helping them to relax and release. So, specifically around a bowel movement, the pelvic floor muscles' role largely is to relax and lengthen. This allows the smooth muscles within the sphincters and within the anal canal to distinguish between waste that is solid, liquid, or gas, and then propagate that waste through depending on what we would like to do. So these systems work hand in hand to hold in our poop and our gas when we want to, release our poop and gas when we want to. So essentially, when we examine a patient, we hope to see pelvic floor muscles relaxing and lengthening during the time of passing and having a bowel movement. In the diaphragm or up into the torso, what we should see is the diaphragm. We want that to kind of relax and lengthen, which also helps the pelvic floor muscles relax and lengthen. And what this also does is helps generate a little bit more pressure within the abdominal cavity that helps with downward facilitation or outward facilitation of your bowel or of your stool. Your abs or your core muscles then that wrap around the torso should be contracting but lengthening at the same time to control and contribute to that downward pressure, but to do so in a very efficient way. So instead of pushing out as hard as possible, we want to see a very controlled outward contraction of the abdominals to control pressure into the pelvic cavity. So, what are bowel norms? And these usually catch patients by surprise. But essentially, a normative bowel routine would be to have a bowel movement up to 3 times a day or 3 times a week. Typically, we want to see what's called a type 4 bowel movement, which is soft and formed. So, not too soft and loose, but not too hard and in small little pebbles or ball shaped spheres. We want to see the color be that typical brownish versus being black, more white, more blonde, more yellow, which could be more indicators of maybe blood in the stool or irregularities with the bile content or inflammation. And then as far as the timing of digestion, so digestion really occurs over a 2 to 3 day span. So from the moment food enters your mouth into your stomach, it's going to take upwards of 48 to 72 hours to digest through and become waste that you then poop out. Things that will speed this up could be digestive stimulants. So think like something caffeinated, something spicy. And then things that will slow this down would be reduced physical activity, food content that's high in fat. So for example, red meat takes a longer time to break down versus a leaner meat like a turkey or a chicken, if you will. Your fluid intake, so how much water you're taking in, that will help to keep the quality of your stool in a really nice state as it works through your GI system. And then how frequently you're eating. So chewing alone will activate the small muscles within the GI system to propagate your bowel and your waste through. So eating regular, consistent meals that require some chewing is actually really good for encouraging your waste to move through your system. Some other things that can impact these bowel norms are your sleep. So, as we sleep, we are resting and digesting. So, all of that movement through your GI is occurring. So, when patients have irregular sleep hours and durations, that will highly impact the regularity of their bowel movements and their overall bowel health. Hormones can have a huge impact, especially when we're considering women in pregnancy and postpartum, as well as perimenopause and menopause. Mental, emotional, mood, stress levels, altered stress, where we see increased levels of cortisol. This can significantly impact your GI's function and can contribute to some things like bloating, gas, cramping, food sensitivities, and some pain conditions. And then ignoring urges. So individuals who delay an urge chronically, meaning they delay, and don't go to the bathroom when they have a bowel urge, this can contribute to reduced bowel sensation, where they'll slowly feel the urge to defecate less and less, and it will slow down propagation as well through your GI. So the major bowel disorder that is often seen in pelvic PT is constipation. So this is essentially reduced quantity of bowel movements in combination with increased effort and strain relative to having a bowel movement. So this can lend someone to feel like they have to push really hard, they have to bear down really hard. It might make them feel like they don't empty all the way. Their stools might be small, lumpy, hard spherical shapes. They might take a really long time to pass it, and they may even need to manually assist their stool in order to pass it fully. The other condition that can sometimes coincide with constipation is what's called dyssynergia, which is essentially a term to describe when the muscles and the nerve system, so within the anal sphincter, within the lower rectum and anus, the muscle and nerve systems are discoordinated. So when a patient goes to evacuate and to pass a bowel movement, the muscle activity that we want to occur doesn't. So when we want actually some of those skeletal muscles of the pelvic floor to relax, they don't, they contract. And this can lead to a patient feeling like, I'm trying to push and working really hard to push my bowel movement out, but nothing comes out, or it comes out in pieces. And it takes a full day to try to get my bowel movement to come out fully. This can also render people to feel a lot of spasm and tightness around the rectum. And can also cause some abdominal straining, in which they feel like they are really overusing their abdominal muscles, their breath holding, in order to expel their bowel movement. So when someone comes to pelvic PT for symptoms of constipation, we are always going to start out with a really in-depth history taking or consult to get a really great idea and concept of the symptoms they're experiencing. We're going to talk bowel health specifically, as well as overall general pelvic health, as well as their nutrition, their fluid intake, their physical activity and exercise, and their day-to-day physical kind of norms. In addition to that, then we're also going to do a assessment of the pelvic floor. This can be done via ultrasound. It can also be done manually through an external exam as well as an internal exam. So depending on how patients are presenting and their symptoms, we'll have that discussion of what kind of exam is indicated for them. We'll include an orthopedic assessment because the pelvic floor works so closely and relies so much on the hips and on the abdomen and the torso and the back. Treating pelvic floor PT can't be done well without including assessment of those joint structures and features. So we would take into account hip mobility, core strength, back mobility, things like that. And then we would do a really fully encompassing bowel diary where we're having individuals track their bowel movements, what they look like, what they feel like, how often they're occurring, and what their nutrition is like, what their water intake is like, and just what their patterns or triggers are relative to the symptoms they're having. Once we have all of that information by the second and third appointment, then we can really set the tone and set a plan of care to help address these symptoms. And most of the time, we lean heavily into discussions on lifestyle choices and behaviors. So how an individual is moving, how they're exercising, what their nutrition and fluid intake is like, what their mood state is like. Those are probably the lowest hanging fruit with the highest return and highest reward, where if we can address and optimize those, then we can really move the needle on a lot of their symptoms. Beyond that, we would potentially discuss bowel routines and bowel schedules to improve the regularity of bowel movements. And treatment then could consist of hands-on pelvic floor treatment. It may consist of optimizing hip and core strength. It may consist of focusing on abdominal pressure management and coordination with the pelvic floor. And it may be just generally moving the needle on an individual's physical fitness and activity level. It's incredibly variable patient to patient. And is highly based off the examination process and what different features stand out within their assessment. But in general, I would say with all of our patients, our responsibility in PT goes beyond just treating those immediate symptoms of constipation and flows into optimizing a person's general health and wellness for obviously improving their current experience and ability, but thinking long-term with aging, how can we set this person up to age really, really well with really great health and reducing their needs for additional healthcare services, reducing future risk of injury and dysfunction or impairment. So we really pride ourselves on moving patients, walking with them through their symptoms and into that next level of thinking longevity and best possible health outcomes for the long term. So this brief presentation was really just about constipation, a little bit of glimpse into pelvic health and specifically bowel health and function. It is by no means exhaustive. So if there are questions, please feel free to contact us via email, via phone. We would love to help you, your patients, providers in any way possible, again, to improve the health of our individual patients and our community as a whole. Thank you.